It's going to be very hard to summarize 3 presentations into one, but I'll try. Before I do that, first we will start seeing what men can do in preventing intimate partner violence. And men is the usual focus. Either he is called the perpetrator or the culprit or whatever, or the power imbalance. Poor guy, you don't know what men can do to you and why that happens. Sasa has tried to address those issues by combining men and women together. So let's hear from Fredrick Nyagah, who is the man, has worked in several programs like the Champion program in Tanzania and the Men as Partners program, and now as Men Can, Men in Kenya. He's the national coordinator of the Men Can since 2006, and therefore we would like to hear what men can do. Not only men in Kenya, men everywhere.
Thank you, Professor, for that. Thank you very much. Good morning, everyone. I'm Jambo. You know where I come from? When you greet people, they must respond. I'm Jambo. Good morning. Now we are together. We have to respect our culture. That when you respect people, when you greet people, they respond. Yeah, that is where I come from. I think Dr. Ian Askew has been there for long, and he knows that. You don't just say good morning and then people keep quiet. Now let me start by introducing my colleague from Men Engagement Network, Catherine Gidai, so that you can just stand up. Yeah. The reason I'm introducing her is that for you to engage later, you can also see her. She has all the information concerning this. I hope because the others have taken longer, that they have not eaten to my time, but to our time combined. But I'll try to move fast. That is the outline of the presentation. I'll talk about the organization, the survey that we did, the intervention approaches, partnerships and opportunities, and then make some recommendations. Men Engagement Network, let me clarify that it is not a men's rights organization. We are not fighting for the rights of men. Rather, it's an organization, it's a network, it's an alliance of organizations that have come together to support women's rights issues. So I'm not here to fight for the rights of men, but to support what women are doing. I think by saying that up front, then I'm safer. I feel now I'm safe. Because when I look ahead, the majority are women, and I can imagine they were tensed up, imagining that I'm coming here to defend the rights of men. Neither am I coming here to fight men. We're only saying that we can work together to fight gender-based violence. And my other assumption is that I'm not here to try to convince anyone that it is important to engage men, because I think we all believe it is important. Otherwise, I will not waste a lot of time telling you why it is important, because you know it is important. And that is why we are here. The main focus of the network is the prevention of GBV and HIV/AIDS, promotion of sexual and reproductive health, positive fatherhood, promotion of positive fatherhood, building capacities, and networking with others. We have been doing this through 2 projects. One of them, the purpose was to scale up the work to engage with men and boys in reducing gender-based violence and sexual exploitation, preventing HIV, and promoting gender equality. And the other one, which was funded by United Nations Trust Fund, was to engage men to strengthen the implementation, that is to strengthen, of GBV laws and policies, and to promote gender equality. Of course, as I've already said, we know it's important to engage men, because half of the population worldwide are men. So if you're having any program which is leaving out men, you are leaving out 50% of the population. And they are not just ordinary people. These are the guys who hold a lot of influence at home, in the community, at the policy level. They have the resources. They have personal investment to make. When there is peace, there are people who are perpetrators. And even sometimes, they also suffer when there is no peace. At home, even if he is a perpetrator, you can be sure he emotionally suffers. And the other day, it was in the papers in Kenya, for those of you who come from Kenya, when we were talking about gender-based violence. Many times when men kill others, their family members, they kill their children, they kill their wife, then they kill themselves. So at the end of the day, they end up dying anyway. And even if they don't die, they'll be jailed. Even if they're not jailed, the society will look at them differently. They end up suffering. So they stand to benefit when there is peace. And therefore, we need to engage them. So then, in this project, we implemented it in conjunction with the Songa Gender Justice Network, and we have similar project in Sierra Leone and Rwanda. We are doing almost the same thing. And coming to Kenya, is that during the Kenya Demographic and Health Survey of 2008, it revealed that 26% of all married, separated, or divorced Kenya women have experienced emotional violence, 40% experienced physical violence, and 16% sexual violence. And actually the same survey revealed that the situation was worse in Western Kenya. And therefore we decided to deliberately come up with an intervention to target that area. But to ensure that it was evidence-based, we decided to carry out a baseline survey to find out how comes the level of gender-based violence is higher in the region than other areas of the country. And the objective of that survey was just to identify the GBV levels in the area and its manifestation. And we deliberately selected Kisumu and Kakamega counties. We have 47 counties in Kenya. And the reason we selected this one is because we knew our partner organizations operate there, and it was easier for us to implement, because as a network, we implement through partners. And therefore, we intended also to map the knowledge, attitude, and practices around GBV and HIV and AIDS through qualitative mapping with a focus on constructive engagement, and also to assess the level of awareness on GBV and the existing legal framework. We wanted to know, do people know about the laws against GBV in the country? The methodology, it was descriptive cross-sectional study. I don't want to go into the details of that. We selected the area deliberately. We did sampling and all that which is necessary. And then maybe of importance is that we applied both qualitative and quantitative, where key informats were interviewed and focus group discussions were held, and we also and questionnaires to do the same. This is just a group of people who are being interviewed. About over 700 respondents were interviewed, where 52% were male and the others were female. I don't need to go to the details of that. And I'll just give a summary of findings on factors associated with intimate partner violence. What did we find out? Because it is based on this that we came up with interventions. So, concerning, we wanted to find out about the childhood experiences of the people. How are they brought up? What about the expenditure at home? What about the health services and the condom use? That is because of the sexual violence aspect. What about the sexual partners? What about the GBV campaigns in the community? What is happening? And what about the opinion on the laws on violence against women? And what about the privileges of men in the community? And the distribution of tasks and the types of violence and community campaigns at that level. So I will just rush through, and in the next presentations, what we have highlighted in red is to show some of the areas of our concern. So one of the things that came up, I think there's something missing there. I think it's missing, but it must be down there, is that we wanted to find out how these guys were brought up, but we realized that only very few people are brought up by fathers. Oh yeah, it is there, but I don't have it here. That's why I was getting confused. Because that is what I was looking for. Those guys who are brought up by fathers only are only 4%. That already is telling something, that the fathers are not engaged in bringing up their children. So we are not surprised when the boys start behaving in a funny way, because they are not seeing role models. Again there, what we can see, overall decision-making on household, that one of our concerns is to find out that the final word when it comes to siblings' welfare, 44% of the respondents indicated that the father decides, and 20%, just a fifth, is the decision made by the mother. You can see these guys are not bringing them up, but when it comes to decision-making, they come in now to make decisions. And also when it comes to 43% say the father decides on large investments. Concerning the sexual partners, you can see a good number. What can be seen there is that a good number are having more than one sexual partner, including one occasion or one night stand, and even they are cohabiting with others. But when it comes to condom use, it is not very interesting. They are not interested whether they are cohabiting or having multiple sexual partners. So you wonder, after they have had that one night stand with someone whose status they don't know, when they go home and they are not even using their condom, what happens to their spouses? What happens to their partner? Is this not sexual violence? Only about half were aware of laws about violence against women. And over 20% said that the laws were too harsh. That's what they felt. These laws were too harsh. Concerning the privileges of men and their opinion on rape, distribution tasks, is that about a quarter feel that men have a right to have sex, even when a woman does not want. It's their right. After all, have they not paid the dowry? They are the men. 28% agree that women are raped. Can you imagine? When they have done something careless to put them in a situation. Basically, when women are raped, they are being blamed for the same. Even others felt that in some cases, actually women wanted to be raped. It was so disgusting. I'm only giving facts about the survey. I'm not saying I believe that. That's what they said. You can imagine. Yeah. And when it comes to the sharing of the house chores, it is left to women. And men are doing very little, but apart from a few things. Physical violence, of course, you can imagine, about a quarter said that they had slapped or thrown something at a woman at least once. Of course, it was closely followed by pushing, shoving, and so many things. And the majority of the respondents admitted that they have friends who use violence on women, and only 1 out of 10, and 17% saying that they would actually question their friends who are violent. It's like, it's okay, you are a man. 4% reported having raped a woman. It might look small, but you know the dangers of rape. The life-lasting effect, the HIV, because of rape. They should not be there at all. When it comes to campaigns on GBV, only 46% reported, 46% reported not to have been involved. They are aware that these things are happening, but they are not involved. So whom are we targeting when you are doing these campaigns? Because the community are saying they are not involved. So people just go there, they are doing advocacy, they do all sorts of things, but the people themselves are not involved. So let's now come to, based on that, we came up now with interventions. And basically, we are using what we call the ecological model, where we target the man at the individual level to change his attitude, to change his knowledge, to increase his knowledge. And then that is not enough. Because even if you change the man, the way the man has been socialized, you need to go a step further and change the peers, because men tend to listen so much to men. And that is why you find so many men, for example, during the World Cup, you find a good number of men arriving home late. They're with their peers watching football. And as they're watching football, they're discussing other things, such that if a man was transformed, he can easily be brought back by the other men because of the influence that they have. So we have to target the man as an individual, the peers, and even the family. Because sometimes the man may want to change, but the woman might feel differently. She might feel different. Why are you doing these things? Why are you not behaving like other men? Go out there and be like a man. Why are you always here? Sometimes the women become enemies of themselves. There are so many men who want to help in the kitchen, for example, but they're pushed out because women feel it is their territory. So why are you complaining when men stay out late? Then you have to go to the community and change the community norms, because these families exist within a community. And also the community is guided by the existing laws. So we have to target the policy, the society. So generally, that is what we are trying to use as a program. And therefore, there are 3 approaches of engaging men. Many of you are aware of these approaches. That's so? So that I don't have to waste much time on this. Anybody who is not aware of this, so that I can spend 2 minutes? I spend 2 minutes? Then why are you afraid of raising up your hands? All right then. So when you're talking about these approaches, there are 3 approaches of engaging men. One, the first approach, and the simplest approach, is where you engage men as clients, to get men as receivers of services. Even if it comes to violence, some of these men actually are doing it because they don't have good information. They think it is okay. They are wrongly socialized. So they need information. These guys sometimes are sick. They need counseling as a service. This is a sick person, some of them. So they need those type of services. They might need support to change. So this is why now you target men to receive the services. The other one is where you now get men as supportive partners. You get them not for their own sake, but because you know of their importance in the community, in the society. They have the resources. So you get them on board so that the children and the women can benefit. And then the men as agents of change is where now men who have already been transformed are used to bring the change in the community, the change that we want. Sometimes you can combine depending on resources. So where there are these intersections is where you're talking about combination of different approaches. And in this program, we are trying to use the 3 approaches. Quickly, at the national level, what we did at the national level, we scanned the GBV laws and the policies to see the language which is used to engage men and boys. Many times policies will just say men will be engaged, but they're not saying how. Men will be involved. How? So what is the language there? So we did the scan, and we also, after we did the scan, we were able to disseminate the same so that the policy makers can be able now to use proper language, which is actually strategic in engaging men. We started men care campaigns where we are talking to men through our partners, of course, to have fathers in caregiving, because many times men are not involved in that. We carried out this baseline survey, which we also disseminated at the community level and to the county level. We recruited what we are calling community change agents. They were recruited and they were trained, and the majority of them are men. They were trained on community mobilization skills and strategies to be able to carry out community norms. They just a report. I'm sorry we did not carry the hand copies, but we can be able to give you the link so that you can be able to get that. Challenging social norms is continuing at the community level. Referrals for the services to the survivors, and also those perpetrators who need counseling are also refined for that type of support. The others, of course, who may not need to be cancelled, but they may need to be dealt with through the law. You know that these people cannot change unless they are forced. So we also assist them to ensure that they are taken to the police and they are taken to court. It's also helping them, don't you think so? Because if you cannot change by being talked to, maybe when you go behind the bars, they might teach you a lesson or two, and it will be a lesson to the others. So we are about to do the endline survey, and then maybe able to scale up if resources will be there. So is it really working? Well, we have not yet evaluated the impact, but based on what we are getting from the field, from the monitoring, we are getting very good reception. The community change agents are getting very good reception at all levels. Religious leaders are buying the ideas so much. We have positive responses and reduced incidents of partner violence, even in the universities. You know, in these days when that students are living as if they are married in the house of residence, and they have been very violent. You know, in the university that we are targeting, the university has told us that those things have reduced as a result of the community change agents in the university. Some of the change agents are university lecturers, and others are students. I'm most winding up now, because I can see I have about 10 minutes, if I'm not wrong. So, yeah, almost. So we are also working closely, Yeah, so we are also in partnership with other CSOs. We partnered with many CSOs in Kenya, and we initiated introduction of protection of domestic violence bill and amendments of the same to make it better. This bill is already in Parliament. It was read a second time, but after reading for the first time, the Committee on Justice and Legal Committee of Parliament mutilated it so badly that we had to go back again and call them. We engaged with them, we discussed with them, we had a meeting with them, we took them through what we could even call workshops to show them that they had messed up, and they embraced the idea. So they promised that we are going to support that bill. And if it is passed, I'm telling you, it is going to actually reduce intimate partner violence a great deal in this country. And the referrals for services are continuing. Opportunities, we are working closely with other countries. We are sharing experiences like I'm doing now. Men Engage Africa Region and Global Engage is another forum that we use. And we are also using the media to reach out to other people, including the print media and others. And basically what I would recommend as I sit down is that we need to create awareness on the policies, laws, and effects of IPV and GBV in general. We need to work with men in GBV interventions and in promoting healthy sexuality, as well as address the wrong notions of male sexual entitlement and in the area of prevention of GBV. We need to work with young people, particularly boys at an early age. Let us start at home. Let us socialize them differently. In schools, in churches and mosques, what messages are we passing to these children? Act like a man. What are we telling them to act like a man? Go out there and fight. Why are you coming here crying? You are a man. A man should fight back. We are the people. We are the universities that teach violence in our homes. Buying our children guns as toys to train them how to shoot and kill. So I am surprised if they kill one another and they are partners. We need interventions against GBV. Interventions against GBV should take into account the socio-cultural orientation of the communities and change the social norms of acceptability of violence and subordination of women and girls. We need intense public education campaigns to cover the wider context that nurtures the wrong cultural practices. We need to empower women socially, economically, and psychologically to stand up for their rights. They should not accept to be beaten up, to be humiliated just because their food has been burnt up. They should refuse. But if they are not empowered, they think it's okay. Educate men on GBV laws and policies to support strengthening of legislation and implementation, and we need to enact and implement strong laws and policies that protect survivors of GBV and deter the would-be perpetrators. we were trying to mobilize people. These are training of men. And down there was a girl who was raped, gang raped, and left for the dead. Her back was broken in Busia, Western Kenya. And when the case was reported to the police, the perpetrators were only asked to cut the grass and go home. Yes. We had to demonstrate, to mobilize the people. We went to see the Inspector General of Police. We thank God. Right now, one of them was arrested. The others have ran away. We hear they are in Uganda. If you see them, bring them back home. They are waiting for justice. Because we cannot stand this. Not anymore. These are policymakers, members of parliament, signing their commitment to end violence and their commitment to support the Protection Against Domestic Violence Bill. We will be monitoring them. The guy there is the chairman of the young parliamentarians. He committed himself and is the chairman of the ruling party, the TNA, and he promised us and he signed. We are monitoring. And those people who are not going to support it, we tell the people to vote them out. We don't need such leaders. Ladies and gentlemen, to change this, it starts there. That guy is just walking comfortably, smoking, and it's okay. After all, she's just a woman. Beast of burdens. To change fundamentally how boys and girls learn to relate to each other, and how men treat girls and women is a slow, painstaking work. But surely, our children's lives are worth every effort. Thank you very much.